Hello everybody, my name is Tommy T. Welcome to my video on wound healing in body piercing. Hi everybody, Tommy T here. Welcome to my video on wound healing in body piercing. In this video, I'm going to go over some of the reasons that piercings heal pathologically. I'm going to go over metal ions, and I'm going to go over how epithelialization can be prolific and how cell growth can be pathological, and what happens in the inflammation stage of healing that causes piercings to go wrong. So remember from my previous videos that wound healing occurs in 4 specific and highly coordinated phases: hemostasis, inflammation, proliferation, and remodeling. The inflammation stage is probably the most important phase because that's where your body is trying to determine what is going on. You've got chemical impulses going on, you've got growth factors going on, you've got the ECM trying to develop, you've got macrophages and neutrophils running around gobbling up debris and also pathogens. And it's in this phase that determines how long the inflammation phase is going to last, and if the body can control what's going on, or if the body is going to become overwhelmed. And if the body is overwhelmed, that's when we get infections. That's when the bacterias win or viruses win, and also that's when something like a particle, like a density or a mass, can cause a problem for your wound too. So one of the things about body piercing is we put metals in your body. Your body's designed not to have a piece of metal in it. So the way that we do that is basically we're trying to trick the immune system into having a piece of metal in your body is designed not to have in there. And the way we do that is we pick metal that isn't high in metal ions. The metal ions attach to proteins in your body, and they can start the pathological process in wound healing. They can start cell proliferation, and you can have epithelialization proliferation, where you have too much and too fast a growth with your skin, and you can also have ischemia, where the epithelial cells do not grow all the way across the wound. So we're going to go over that stuff, and hope you enjoy my video. In order to achieve optimal wound healing and piercing, we need to look at the circumstances that occur that interfere with the wound healing process. Types of wounds, the innate healing process, molecules that recognize antigens, chemical responses, and pressure all play a part in how a wound heals. The 2 main initiators of response from the body are substance and mass. Substance can be a pathogen or it can be a material such as an iron. A mass can be any density that creates a negative response to the biological functions of the body. For now, let's look at substance. A substance can be a pathogen, bacteria. For example, it can be a gram-negative rod with specific antigens, such as Acinetobacter, that has a lipopolysaccharide layer with a lipid A that produces endotoxins. Endotoxins can lead to sepsis and death. Endotoxins destroy the epithelial layer inside your vascular system. A substance can also be a different type of foreign body, such as a metal. Metals are used in many functions in modern dentistry and medical implantation. For today's video, let's focus on metals and how and why pathological healing occurs with piercings. So I want to go over a little bit with you about the inflammation process and what happens when you get a piece of body jewelry in you, a metal piece of body jewelry in you. And like I had talked about earlier, there's 4 stages to healing: hemostasis, inflammation, proliferation, and remodeling. The inflammation stage is very important. That's the second stage of healing. During the inflammation stage, that's where most of your activity starts, and that's where your body basically goes into search mode and starts to try to figure out what's going on. Do we have any pathogens here that have invaded the body? Are there any foreign particles? Macrophages and neutrophils, they're going to be searching that stuff out, and they're going to be given chemical signals. And so the inflammation stage starts a whole sequence of actions. One of the first actions, your cells are going to try to determine whether or not whatever has come on the inside of you is immunogenic or reactive. Pathogens are foreign bodies. A virus, a bacteria is a foreign body. If a bacteria gets inside of you, it's going to send out certain chemical signals that your neutrophils and macrophages are going to pick up on, and they're going to know that it doesn't belong there, and they're going to go after that pathogen and try to destroy it. The same thing with metals, but it's a little bit different with metals. Metals put out metal ions. Metal ions in themselves can't really do much, but the metal ions attach to your proteins, and then they become immunogenic. And that's when your body can start to recognize them, and that's when you start to have allergy situations and hypersensitivity. So high metal ion release overwhelms T-cell mediation and results in uncontrolled and uncoordinated events, such as scarring. These metal ions bond to proteins and elicit an immunogenic response, resulting in prolonged, exaggerated inflammation and pathological cell proliferation. Once your immune system is activated, it goes into search mode. This is a function of the inflammation stage. During this stage, chemotaxis migrate towards foreign particles and substances. At the same time, metal ions from the jewelry are binding with proteins. Once this binding occurs, the proteins form hapton protein complexes, which are antigens. These antigens processed and presented to T cells, which in turn mediate hypersensitivity. So some substances by themselves are not capable of causing our immunoreactions. Poison ivy is an example of that. Poison ivy isn't really bad. It's not going to really cause a problem for you until it touches your skin. Once it touches your skin, it binds to the proteins in your skin, and that's when you start getting a reaction from it. Okay, so what does all this mean? Well, your body needs metals for many of its functions. Metal moves around the oxygen in our bloodstream. However, too much metal initiates hypersensitivity and overwhelms our innate immunogenic system. So then what happens? Your body gets overwhelmed. Your innate immune system can get overwhelmed by a virus, a bacteria, or metal ions. So let's talk about metals a little bit more before we move on. Like I had mentioned before, there's 4 stages to healing: hemostasis, inflammation, proliferation, and remodeling. The inflammation stage is the stage where most of the activity happens, or at least is initiated to happen. That's where your chemotaxis start going after certain chemical messages, and your body is basically deciding what it's going to do with this wound. Metals give off metal ions, and metal ions, once they bind to proteins, they start to send out immunogenic signals. The proteins form hapton protein complexes, which are antigens. These antigens are processed and presented to T cells, which in turn mediate hypersensitivity reactions. Your innate immune system can get overwhelmed by a virus, a bacteria, or by metal ions. And in this case, the metals have overwhelmed the system. And the good thing is there's plenty of body jewelry companies out there that make implant grade jewelry. It's imperative that you get pierced with implant grade jewelry. Implant grade jewelry has already been tested and developed and accepted by consensus standard associations. So most metals have been classified by consensus associations using the in vivo Buehler test on guinea pigs to determine metal ion release and hypersensitivity issues. The body piercing industry has many metal manufacturers that make implant grade jewelry. Okay, so number one, get pierced with medical grade biocompatible jewelry, and don't just take your piercer's word for it. Ask them, what is the ASTM standard of the jewelry or the ISO standard that you're piercing me with, and look it up yourself and see if it's implant grade, because a lot of piercers actually do not know what medical grade jewelry is. So that's number one. We're going to get into pressure here in a minute, and we're going to explain why pressure also causes pathological healing in just a minute here. So let's say that you've picked the right jewelry made of a biocompatible material from the right manufacturer who manufactured the jewelry using appropriate methods to achieve implant grade results. Now let's look at the piercing and the healing process. Okay, I'm going to go over several factors that affect wound healing. Before I do, I wish to promulgate a couple of principles for you to follow. One, if at possible, always pierce 90 degrees through the skin. Okay, so if at possible, always pierce 90 degrees through the skin. Why is this important, and is it even possible all the time? To answer that question, it's not possible all the time. But where you can, it's always best to pierce 90 degrees through the skin, because 90 degrees through puts the least amount of pressure on your cells and gives you the best chance for a normal healing. Okay, so let's just look here. Let's just look here real quick. So say you're being pierced. This is the outside of your skin, and you're being pierced through. Let's say this is your nose. You've got the outside of the nose, and you have the inside of the nose. Now, to most people, it might seem like common sense to pierce straight through, but that's not necessarily the way that it works. A lot of piercers use an insertion taper, and insertion tapers. So a lot of piercers use insertion tapers, which I don't believe are the best thing to use for a nose. Insertion tapers work great on private parts, but they're not really designed for nose piercings. And one of the reasons why is because piercers tend to turn at the last minute. They get a little bit nervous that they're going to miss the insertion taper, or they're going to poke somewhere else in the nose. They tend to turn their wrist at the last minute, which makes the inside of the piercing come off just a tiny bit. And if you don't go 90 degrees through and you make this piercing angled at all, chances are you're going to end up with a bump on your piercing. And one of the reasons that some piercers tell you that you can't get pierced with a hoop, which is not true, is because they do exactly this. They use insertion tapers, they don't pierce 90 degrees through, and they end up having bumps on their nose piercings. So, number one thing is pierce 90 degrees through, if at all possible. That one thing alone will solve so many problems as far as not getting bumps on your nose. If you pierce with a hoop, it's still the same thing. It's still 90 degrees through. The hoop just goes like this, and the angles are the same. It's still a straight piercing right through. The best way to achieve this is by using clamps. clamps, when you use a clamp, let me get on this side here. When you use a clamp, a good piercer using a clamp, you'll never even know they're using a clamp because they're so gentle. A piercer with not as much experience, you might feel it a little bit. But a piercer that has experience is going to very gently close that clamp. All the piercer is doing is clamping on the outside and very gently holding the skin so that this skin here does not move and this skin here does not move. This is mucous membrane on the inside and this is the epithelial layer on the outside. It doesn't move so that when the piercer pierces you, that piercing remains 90 degrees through. A piercer without too much of experience might accidentally touch the skin when inserting the tool in you. And what I mean by that is they might rub the tool up against the skin, therefore pushing the mucous membrane up in the nose so it shifts the skin. So what happens is when they pierce you, they pierce 90 degrees through. It's a good piercing, but then when they declamp, this skin shifts down and the piercing actually is pierced on an angle like that. If that happens, you're going to get a bump. It's going to happen. So picking piercers that know that. I know a lot of piercers who've been piercing for 10, 15 years that still don't get that down. Okay, so insertion tapers, you know, in my opinion, not good for nose piercing. If somebody wants to use them, that's fine. I have yet to find an insertion taper that can hold the skin still on the outside and the inside of the piercing. It's just not out there. So for your best nose piercing, the piercer is going to hold the mucous membrane layer, epithelial layer, pierce exactly 90 degrees through. Now you're all set up for good healing. So going back over this, you've picked the right jewelry, it's biocompatible, it's made by a company that makes implant grade quality jewelry. The piercer has pierced you right, it's exactly 90 degrees through your nose, for example. We're talking about nose piercings right now. The second principle that I want to go over before we go on any farther is the importance of sea salt soaks. A sea salt soak is exactly that. It's a soak. It's not a spray. Sprays do not do the same thing as a sea salt soak. A sea salt soak is designed to saturate the piercing. It's almost like you jumping in a bathtub of water as compared to walking into one of the showers with those energy efficient shower faucets, heads or whatever. It's just not going to work as well. You really want to soak the area so that the sea salt soak gets far enough into the wound so that it activates the inside of the wound to push more bad stuff out. We're not trying to trap stuff in, we're trying to clean it, we're trying to keep the flow going so your body can do its job and cleanse that wound out. And I'll go over how all that works in just a second here. All companies need to have a written, uniform company policy for wound care for each type of piercing. A generalized aftercare form isn't going to work. You need to have a policy that specifically outlines how to deal with each type of piercing and what type of causes or effects occur with that specific piercing. So you've been pierced, you've gone home, you're through the hemostasis stage of the wound healing process, and you're now in the inflammation stage. The inflammation stage is important because that's the stage where the molecules in your body, your cells, are activating the innate immune system. And your body has recognized that there's an injury here. So you're going to have macrophages and neutrophils that are going to be out looking for debris, and they're going to be out looking for microbes, pathogens, and they're going to do their job. Macrophages can devour one foreign particle after another. It can devour one bacteria after another. They keep eating them, devouring them, surrounding them, whatever you want to call it, and then discharging what's left. And neutrophils, the way neutrophils work is neutrophils can only kill once. So a neutrophil is a white blood cell that is defending you against bacteria, viruses, and foreign objects. And it's kind of like a bee. It stings once and it dies. Well, there are billions of these things inside of you. And as long as they're not overwhelmed, then you're doing fine. They're going to die. Your body's going to flush them out of the wound, which is also a secondary response to cleaning the wound out. These particles, along with fluid, water, is going to come out of your body, and it's going to dry on the outside of the wound. That's where it starts to become a problem for you. For one, it's bacteria food. So if it stays out on the outside of your skin and isn't cleaned away, it will actually multiply the bacteria and pathogens that are normal flora on your skin that you live with all the time, that are opportunistic, and once they become in large enough numbers, they can infect you. They can overwhelm your immune system. So we need to get rid of that stuff. Also, dead tissue on the outside of your body next to new healing tissue is not good for you. It's necrotic tissue. It can kill your baby skin cells that are trying to heal. So we need to get rid of that stuff. And the way that we do that is with a sea salt soak. Now, a sea salt soak is exactly that. It's a soak. It's not a spray. Don't use the sprays. They're a great gimmick and everything. They seem like they're easy to use. I know a lot of really good piercers who back them up. I also know a lot of really good piercers that got paid a good sum of money to be a consultant to back them up. So you might hear good stuff about them, but the truth is, if you go back in the history of body piercing, if you listen to the forefathers of body piercing, they'll tell you absolutely do not use sprays, use sea salt soak. Some of our forefathers aren't here anymore, but yeah. So let me show you how it works. So you do the soaking on the wound, okay? There's a couple different ways that you can soak. One is you can use a cap and like a medicine cup. We actually have our own, so I'm going to do a little plug here. We actually have our own sea salt soak. It's natural ocean water that's been sterilized and filtered. It works wonderful. We've been using it for a very, very long time. We have medicine cups that we sell with it. So you use that medicine cup, you fill up a little tiny bit in the cup, put it on the wound so that the wound is submerged in the sea salt soak, and you wait 5 minutes. And what will happen is the sea salt soak will come down and it will penetrate all the way in, even into the inside of the wound, all parts of the wound, all the way down here. And it will break up all the dead plasma and other particles and fluids and cells that come out of your body, little pieces of skin that are breaking off and whatnot. And it'll break break it all up, including what's attached to your skin, because some of that dead tissue is going to attach itself to your skin. That's bad. And some of it's going to attach itself to the jewelry. So sea salt soak, 5 to 10 minutes, breaks up. It's kind of like throwing cardboard in water. It breaks up, like cardboard gets all mushy. It breaks up all the dead tissue, neutrophils, other cells and whatnot that are there. And now they're ready to be removed. To remove them, you get a good old handy Q-tip. And just take that Q-tip, dip it in the solution, and very gently, in a very gentle rolling motion, you roll it right underneath the head all the way around. If you've done your soaking properly, then everything's ready to get removed. This step is super easy. Just wet the head of the Q-tip, wipe it around the top of the post, and all that material will stick right to the Q-tip, and then you just throw the Q-tip away. Okay, so that's the second part. Very important first principle, 90-degree piercings will save you a whole bunch of trouble as far as healing goes, and also aftercare sea salt soaks will save you a whole bunch of trouble too. So let's say you've selected the right jewelry, made of the right material, made from a manufacturer that uses appropriate methods to achieve medical grade, implant grade results. You are doing your aftercare perfectly. You're doing your sea salt soaks, just as I showed you, doing them once a day. So what can go wrong? Anything? Well, unfortunately, a lot can go wrong. It's your body. It's healing. I always tell people, when you have a wound, it's probably a good idea to make sure your sheets are clean on your bed, pillow, bed sheets. Anywhere that you have bacteria, clean your bathroom. Bathrooms are a number one source of infection for people, not just in the community, but also in healthcare settings. HIAs are a big problem in our country. And one of the places that patients get infected is in their bathrooms. So clean your bathroom. Another thing to throw in there real quick is sugars are not good for wound healing. So anytime that you get hurt just a little bit, that's the time to up your game on your diet, and eat some more vegetables, some cruciferous vegetables or whatever, and stay away from sugars. Sugars are bad for healing. As I mentioned earlier, your body's innate immune system recognizes substance and mass. The difference between proper healing and pathological healing can be small, minute changes that affect the wound on a microbiological level. For one, elongated or 90-degree insertions can cause pressure, which activates the innate immune system, therefore disrupting the inflammation stage and further disrupting extracellular matrix production. These actions occur on a chemical level and determine how cells grow and how a wound will heal. I don't want to go too much into growth factors, ECMs, or chemical and physiological functions. All you need to know is elongated wounds with mass in them disrupt the wound healing process and promote pathological healings. So get your piercings straight. Really important. When you put hoops on people, especially noses, I see a lot of nose piercings where the hoop is angled just a bit. So if we're going like this, it'll be just turned just a bit. That's a problem. That's gonna create an issue with you in the wound healing process. If that hoop is bumping up against the wound in any way, you want the jewelry to be sliding smooth through the wound. You don't want the jewelry in any way to be pushing on the wound. So I'm going to go over real quick. I'm going to explain to you how jewelry can push on the wound a little bit. And we go over two different ways. One is with a straight post, and the other one is with a circular. So as far as a circular goes, if you have a circular going through a wound and the wound is not okay, if you have a circular going through a wound and the wound is not pierced exactly 90 degrees through, you will end up with a bump on the opposite side of where the jewelry went crooked. So in this case, the piercing is like this. The bump will always be on the opposite side of that. If you get pierced with a straight piece, if your post is straight through, and 90 degrees is okay, if 90 degrees is like that, and you get pierced on ever the slightest angle, like this, you will have a bump. You will grow a bump. It would seem that the bump is going to occur on this side here because it looks like the post is pushing up against that side. But that's not how it works. The way it works is the piercing is going through like this. It's pushing on the cells on this side, and you will have a bump grow on the opposite side. Basically, if the bottom, wherever the inside hole is pushing, wherever it's at and it's pushing, that is going to formulate a bump on the top of the side. It's basically what it's doing is it's putting pressure on the cells, and it's pushing the cells up like that. Now, this is very easily fixable. If you have a nose piercing, for example, and the piercer used a nose piece on you, and the piercer pierced you straight through 90 degrees, and you went home and your jewelry moved, it twisted, the twisting can then change the direction of the post. So the twisting can actually make the post come out crooked. You'll get a bump. If you go back to your piercer within a day or two, they can show you how to turn that post and how to keep that in the right spot in your nose, and the bump will be gone immediately on the spot. A lot of people ask for nose piercings to be pierced in the crease of their nose. That's not how nose piercings work. Nose piercings work by the inside of your nose, not the outside of your nose. The inside of your nose and the outside of your nose are quite different. Okay, so we went over how even the slightest elongated piercing, the slightest change in direction through the piercing can create a bump on the outside of the wound, and how the bump is going to be on the side of the wound that the jewelry is pierced angular on the inside. So if the post is moved over to the right, for example, in this case on the bottom, the bump is going to be on the right side of the wound. Now, and we also went over how a nose piercing can be pierced straight through the wound, but if it twists and turns, that turning can change the direction of the post, and then once again, you will end up with a bump on the side that the bottom of the post has turned to. That can easily be corrected. If you go back into your piercer, he can show you how to turn it back into place. The bump will be gone immediately. However, if this bump remains on your nose, if you think it's just going to go away, or you think it's full of fluid or something and you try to pop it or anything like that, it can become permanent scar tissue. And sometimes they don't ever go away. Sometimes they take a while and they do go away. So something important to know about nose piercings there. You absolutely can get pierced with a hoop, no problem, as long as it's the right quality hoop. It's pierced 90 degrees through your nose, and if you're using a continuation hoop, it has to be perfectly bent back into a circle so that it's not angular at all and it's not creating any kind of issues with the piercing. Okay, so as far as jewelry placement goes for hoops, no matter where you're piercing somebody on their body, there's a jewelry to wound ratio. Endo placement should be 25% and exo placement should be 75%. 25% of the jewelry should be in the wound and 75% of the jewelry should be outside of the wound. Too little skin, if you have less than 25% in the wound, too little skin and the mass to tissue ratio is weak, and the piercing is more likely going to grow out. Too deep and you have pressure issues, and then you're going to have possibly runaway inflammation and maybe even an infection. So another thing that we have going on with body piercings are a little bit different than a normal subcutaneous wound because they're going through into your body. And in most cases, they're going in skin and then back out of skin. So because of that, they heal differently. They're not healing on the surface of your skin, they're healing through the wound. Your dermis is actually going to heal in this direction here. It heals down through the wound. Now when it's doing that, if there's any kind of pressure, your piercer should be really clear with you not to push, touch, poke, bend. I have customers walk in that have problems with their ears. They've got bumps growing on their ears, and they'll walk right up to me, bend their ear over and say, "Hey, what's wrong with my ear?" And I'm like, "No, don't do that." It doesn't take much pressure at all. All you need to do is just tap on a piercing and you activate a chemical response within the wound that will create pathological healing. If you're bending or touching or not cleaning with a sea salt soak your wound, you can delay epithelial migration, and basically you stop the epithelialization process. Disorganize your glycated extracellular matrix, and you can impair angiogenesis and cell proliferation. Basically, what you're doing is you're disrupting the healing process. And when your body is going through the inflammation process, it's setting you up for proliferation and remodeling. And anything in that process is very specific. You have proteins that they don't quite know what they're supposed to do yet. What they do is determined by the chemicals that they receive, and that tells the protein how to function, what to do. So anything that you do that initiates the wrong response can lead to pathological healing. The most important thing is don't touch, don't bend, don't poke. All you need to do is tap a ear piercing, just because it kind of hurts a little bit, tap it, and you initiate a response that can lead to pathological healing. We're basically trying to trick your body into having a piece of metal in it. Your body is designed not to have anything in it. So if you tap on your ear or you touch your piercing, you do anything that puts any pressure between the cells and the inside of your body and that piece of metal, then you can activate the wound, and you will disrupt the healing process. The healing process will start all over again, but then you're going to have pathological skin growth, and you're going to end up with bumps. So don't touch, don't poke, don't pull, don't bend, and clean away your piercings with sea salt soak, and you should be good to go. So if you guys have any questions at all, I know this was pretty basic. I didn't go too much detail into the science of it, but if you guys have any questions at all, feel free to leave them for me in the comments, and I'll go over them with you. You can get pierced with hoops and noses, no problem. Placement's got to be right. Aftercare's got to be right. Everything's got to be explained to you properly, and you got to basically take care of it. Piercings are not something where you just go and get a piercing and you walk away and everything's okay. It doesn't work that way. It's a wound, and it has to heal properly, so it has to be taken care of properly. Not all piercing places are the same. Jewelry selection is very important. Cosmetic grade jewelry is not implant grade and is not designed for initial piercings, and shouldn't ever be used in an initial piercing. In fact, most states have outlawed cosmetic grade jewelry. So do your homework, find out who carries what, and go to a good piercing shop. Thank you very much, guys. I hope you had a great day, and appreciate you watching my video. Have a good night.